45 million people often get headaches in the U.S., and some get really bad headaches. Migraine is the third most common disease in the world, but for many it goes untreated. Gianna Franco has the story of one person who's fighting back.
I think going through all this pain and, sickness, it feels really good to be alive.
For Crystal Llamas, it's an invisible crushing force that sometimes takes over.
Difficult symptoms to manage, and when you deal with migraine or any chronic pain for a long time, it can really sensitize your brain, and when your brain gets sensitized, anything is fair game, unfortunately.
Migraine disease. You can't see it, and for some, dealing with it silently, like Crystal, it can be physically limiting and isolating.
Not being able to work for so long and not being able to do a lot of things, it kind of makes you question, am I valuable? If I don't contribute to society, where's my worth?
So migraines are one of the most common types of headaches. As many as 10% of people can have them.
That's Dr. Gianna Franco, a neurologist with Kaiser Permanente Redwood City, who says it can be debilitating for some.
It's hard to see, right? It's one of those disease. It's a disease that you can't really tell that you have. How do you get the point across, to your doctor?
I think one of the main things that you should mention is how often you're having headaches, how much they take you out of your normal life, how much over-the-counter medications you're having to take, and how frequently.
She also says it's important to treat it, but to really look ahead at how to prevent a migraine from coming on.
I think the very first thing that you may want to do is start keeping a diary. Not only to identify the triggers, but also to have the information, how often do I have headaches, how severe they are. And then you go to your doctor with this information. And at the point that you're having so many headaches that it's interfering with your life, that's really the time to start talking about prevention.
For Crystal, she has learned to manage her headaches.
This concept of neuroplasticity, so your brain can change, and you can have a role in changing it. And if you can get better and you can get your brain on this new rhythm, then hey, that's hopeful, that's bright, that's optimistic.
And she is using her experience to help advocate for others as a volunteer with the Alliance for Headache Disorders Advocacy.
They organize something called Headache on the Hill, which is this day where they gather patients, doctors, caregivers, anyone who's interested in the cause, to advocate to their legislators.
To help those with this debilitating disease.
Okay, it's a major public health issue. It's an economic issue. Why isn't there more funding? Why aren't there more headache specialists?
Yeah. So they no longer struggle in silence.
Ooh. And yeah, I just have these moments where I'm I'm grateful for this day. Sort of, it just feels good to have this,
Crystal says that getting migraines is something that she still has to manage, but she has made some progress in the past decade. If you get them or think you get them, if you think that you have migraines, be sure to let your doctor know. That's the important thing.